My name is William Valente. I'm from New Smyrna Beach, Florida, and I'm 66 years old. I had a urological procedure that failed, and that sent me for procedure number 2, which also failed. My bladder was not draining completely. I was going into retention. My PVR was escalating over 200, and I felt very uncomfortable about it. I felt very concerned about it, and I knew something was wrong. That was confirmed by 2 of the best hospitals in the state. The stricture was a result of the repair, which was the second procedure. The urination was uncomfortable. The flow wasn't there. I was constantly concerned about it. Yeah, it was definitely impacting it. Well, I have a couple brothers doctors, and I was speaking with them. I went on the internet myself, and I started researching a non-invasive procedure that could solve my problem, and I came up with the Optilume balloon. Physician that performed the surgery was Dr. Raul Meehan from Mesa, Arizona, and it was performed at Banner Baywood on July 31st last year. I would say that this procedure is pretty minimal invasive. I mean, obviously it is a procedure, but there was no blood, no pain, virtually just a short amount of downtime being monitored, a little bit of time healing after that because, it is in your abdominal region. But for me, the 2 procedures I had before that were much more invasive, and the rehab was quite a bit longer. After a week, I felt pretty good. I was taking my time on the flight back, so I did overnight in Dallas. I wasn't rushing back, and try to go easy the first couple weeks, just limit myself to walking, trying to rest as much as possible. Since I've returned here, I have struck up a relationship with Dr. Lucas Weekend, and he's now my urologist of record here in Orlando, Florida. I've just passed a very positive uroflow test, and my PVR is low. So it's kind of no longer concerning. I'm kind of pushing it in the back of my mind. It's been 6.5 months. Most people have told me that at this point, if it's working, it's probably going to continue to work. So, I am wide open to just continuing on and monitoring as I go. Oh yeah, quality of life has improved. I can garden, I can go out in my yard, do what I want. Before that, driving longer distances, traveling, attending sporting events, all those type of things were always kind of in my mind because there was definitely some uncomfortable time there.